Etodolac is a non-steroidal anti-inflammatory drug NSAID used primarily to relieve pain and reduce inflammation in conditions like osteoarthritis and rheumatoid arthritis. Its pharmacology involves inhibiting the activity of enzymes called cyclooxygenases, COX-1 and COX-2, which play a role in the production of prostaglandins. Prostaglandins are substances in the body that contribute to pain and inflammation. By blocking these enzymes, etodolac reduces the production of prostaglandins, leading to pain relief and decreased inflammation. For osteoarthritis and rheumatoid arthritis, the usual starting dose for adults is 300 milligrams to 400 milligrams taken orally once a day or divided into two doses, 150 milligrams to 200 milligrams twice daily. For acute pain or musculoskeletal disorders, the initial dose is often higher, such as 400 milligrams to 500 milligrams taken orally once a day or divided into two doses after the first day. The dosage is typically reduced to the maintenance dose for osteoarthritis or rheumatoid arthritis. The most common side effects of etodolac, like other non-steroidal anti-inflammatory drugs NSAIDs, typically affect the gastrointestinal system. These side effects can include upset stomach. This may manifest as nausea, indigestion, or abdominal discomfort. Gastric ulcers. NSAIDs, including etodolac, can increase the risk of developing ulcers in the stomach or intestines, which may lead to symptoms like abdominal pain or bleeding. Heartburn. Some people may experience heartburn or acid reflux. Diarrhea or constipation. Changes in bowel habits can occur as a side effect. Dizziness or headache. These side effects are less common but can still occur. Etodolac can interact with various medications and substances, potentially affecting its effectiveness or increasing the risk of side effects. Some of the most common interactions include 1. Other NSAIDs. Combining etodolac with other non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen or aspirin, can increase the risk of gastrointestinal side effects and bleeding. 2. Antiplatelet medications. Etodolac can interfere with the antiplatelet effects of medications like aspirin, potentially reducing their effectiveness in preventing blood clots. 3. Anticoagulants, blood thinners. Etodolac may increase the risk of bleeding when used with anticoagulant drugs like warfarin. 4. Corticosteroids. Combining etodolac with corticosteroid medications can increase the risk of gastrointestinal ulcers and bleeding. 5. Selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs. Taking etodolac with these antidepressant medications can increase the risk of bleeding, especially in the gastrointestinal tract. 6. Blood pressure medications. Etodolac may reduce the effectiveness of certain blood pressure medications, potentially leading to uncontrolled hypertension. 7. Methotrexate. Combining etodolac with methotrexate can increase the risk of methotrexate toxicity. 8. Lithium. Etodolac may increase lithium levels in the blood, potentially leading to lithium toxicity. 9. Diuretics water pills. Using etodolac with diuretics can reduce the diuretic's effectiveness and increase the risk of kidney problems. 10. Alcohol. Alcohol can increase the risk of gastrointestinal bleeding when taken with etodolac. It's generally advisable to limit or avoid alcohol consumption while using NSAIDs.